not a patient. We'll also mainly go over what it's like to be a patient going through this process and learning about advocacy and how to stand up for yourself in the whole medical system. So before we start talking about patient advocacy, I just wanted to give a little bit of background about who we are as an organization. Invisible Illness Awareness Network, we're a nonprofit organization, and we raise awareness for different invisible illnesses to primarily pre-health students. Everyone's welcome at whatever meetings our affiliates do, but our focus is on pre-health students, so future healthcare providers will be somewhat knowledgeable at least, or at least not hear about these invisible illnesses for the first time in their graduate programs. So we want to familiarize future providers with a lot of different conditions and just to be knowledgeable about these things before they start their professional programs. We do have one affiliate program at Loyola University Chicago right now that does like a 2-year rotational program of a bunch of different presentations and guest speakers. And we're starting affiliates in some other schools as well. So if you or anyone else know of someone who may be interested in starting something similar at their school to educate future healthcare providers, please let us know. Our Instagram and website are up there, and we'll be available to answer any questions afterwards after we have this lovely discussion with your school. So thank you so much to Jill and everybody else for inviting us to speak on patient advocacy. We're very excited and happy to be here with you guys. So some brief introduction. So my name is Stephanie. I'm co-founder and co-president of IAN along with Sarah. I am a pre-medical student myself, so I'll be applying to medical school in the spring, and I have POTS, mast cell activation syndrome, endometriosis, and a couple other things. And yeah, so Sarah, want to introduce yourself?
So I'm currently at a local community college, but we'll be switching to Arizona State University online in the spring to do their disability studies program. I'm very excited about. And I also have POTS, which I met Stephanie at a Dysautonomia International conference. For those who don't know, POTS, to basically sum it up, dysautonomia, which POTS is a type of, controls the autonomic stuff that happen in the body, stuff that happens automatically. So things like heart rate and blood pressure and digestion, pupil dilation, all of that. It doesn't work the way it's supposed to. So long story short, when someone with POTS stands up, their heart rate goes up, their blood pressure usually drops, which causes a whole host of things like brain fog, the low blood pressure, and literally everything. I also have EDS, which is a connective tissue disorder. To simplify it, connective tissue holds things together in the body. So for example, the organs and the joints. So my joints can easily sublux or dislocate. And
And to briefly describe what mast cell activation syndrome is, we both have. So everyone has mast cells in their body, and they monitor what is in our body. And ours just are overreactive, so they react to things that they shouldn't. So like, I'll eat a banana, and my body will be like, "That's not cool. Don't do that," and react to things that normal people don't usually do. And endometriosis is typically something that is a female disorder. It's people with uterus is mainly affected by it, and it's endometrium-like tissue growing outside of the uterus, so it can cause a whole host of symptoms like pain and things like that. But just a little brief describer for people who are not familiar with the things we have. But we have a lot of chronic conditions, and that's kind of why we started IAN and started doing presentations at different schools to help educate others who aren't as familiar with these things to know that people are going through them.
Okay, so what is patient advocacy? Basically, patient advocacy is standing up for yourself and your needs, and being adamant that you get the help that you deserve. This can be done with doctors in the healthcare setting, could also be in the hospital, or even with your insurance company, whatever you need to get what you deserve. So we will be going over how to advocate for yourself before, during, and after your appointments, how to get accommodations for school and work, and what resources you can use.
So some patient strategies before the appointment, yeah. So before anyone schedules a doctor's appointment, you need to figure out what doctor you're going to go to. So if you have a diagnosis already and you have a condition, ask people who have your condition that you are aware of, what doctors they recommend if you have some in your area. There's a lot of different local Facebook groups. There's a lot of things that you'll find out when you start researching your condition or your symptoms, and just trying to ask people directly what doctors are knowledgeable on certain areas. If you have like certain symptoms that are GI related, what GI specialists in your area do people recommend? What good experience have they had before? And if you don't know that kind of information, even starting with a good GP, if you don't have one already, just a general physician to help guide you and give you referrals, or just guide you in the process of getting a diagnosis or getting help for whatever condition you're dealing with, is a great thing to start off with.
Yes, and to throw out for our students here locally, if y'all ever need help like figuring out what kind of like what doctors locally you got like people recommend around you, feel free to ask on the server. I know like I've grown up here locally, so is Kayla, so we end up kind of gathering like the doctors that know what they're doing and do things right.
And that's such an important resource to have, so that's great that you guys have
Definitely.
that already started for people. Yeah, and something to note when choosing a doctor for the first time too, generally, like there are studies that back up that generally female physicians do have better health outcomes, and going with a physician that is your similar race also tends to have a better health outcome. Just something to consider when you're trying to figure out what's the best option for you. That's just something that's been closely associated. So something also to keep in mind before you schedule an appointment, make an appointment at a time that's best for you. So if you know that your symptoms tend to flare up in the morning or later in the afternoon, plan around that. If you want your doctor to see how you are during a flare, to, just kind of show them what you deal with on a daily basis, go during that time, especially if you have someone to come to an appointment with you to help you advocate for yourself and tell your story and get your questions answered. That might be helpful for you, but you also might want to avoid that if you are going alone or you just don't feel comfortable and you want to be able to answer or ask all the questions that you want and tell them all the information and not risk having symptoms interfere with that. So make sure to try to pick an appointment time that aligns with what you want from a doctor's appointment. And if you are diagnosed with a condition, make sure you do research on your condition before you see a specialist or a GP. Just have a lot of information at your fingertips ready to share with them if they don't necessarily have ideas of treatment options or things that they want to explore with you. It all depends on what you're going to a doctor's appointment for. But try to educate yourself on your symptoms and condition, depending, it all depends upon what you're dealing with. So if you're already diagnosed, like you can research your condition, but if you're not, it can be a little trickier to try to have information with you to do everything. But a good thing to note though, when you are meeting with a doctor, especially for the first time, don't lead off with the information that you've gathered from your research and be like, hey, I think I have XYZ. Present your symptoms and what you've been experiencing to your doctor and ask them for help. That's what they're there for. They're there to help you and see and seek their guidance on what they recommend. Presenting information and some research that you have is more of like a worst case scenario. Your doctor isn't familiar and doesn't really know what to do. You can be like, hey, well, I've researched these things and people have suggested this in the past. Is this some kind of test you can help me achieve or get? And kind of go from there. It all depends upon specific doctor circumstances, but it's always great to be prepared and to know what's going on, especially if you have limited resources and this doctor might be farther away. You want to make the most out of your appointment that you possibly can. So that kind of leads into my next thing of create a medical binder of your past medical history and any research that you've done on your condition or symptoms. Just having all that information readily available is very important, and it's especially helpful when seeing a new doctor for the first time. You can give them just showing like your symptom patterns, anything that you might not think is important, but the doctor might catch on to something that you never thought of. So just having all that information readily available with you is a great thing. And like I mentioned earlier, if it's possible, bring a person to help you advocate for yourself. It's also only, even if you don't think like, oh, I can stand up for myself, I can do everything myself, that's fine. Having a second set of ears is always helpful too. You are going to probably want to be taking notes. We'll go into what you do during an appointment, but having a second person there can help you recall information better. It's a great support, especially if you start not feeling well during an appointment. Just having a second person with you is a very valuable tool if you have that option. Yeah. And also very important, write down any questions that you have for your doctor. A lot of us think going into an appointment, oh, I'll remember to ask them that. That's a super important question. Like, it'll be great. When a doctor tends to come into the room, a lot of us have our, like heart rate, blood pressure might go up a little bit, and we'll be nervous talking to someone for the first time and meeting them. And we might forget in the heat of the moment and really wish that we asked a certain question. So just having those in a list ready to go is super great. And it hopefully will help ensure that you do not forget to ask anything important and make sure all your issues and concerns are addressed. So, and definitely know your rights as a patient going into it. We'll talk a little bit more about that later in the presentation too.
Okay, so what to do during an appointment? As Stephanie mentioned, you want to take notes of everything that happens there during the appointment, what the doctor says, what the doctor does, what they prescribe, and also keep note of, things they won't prescribe. Also be honest with your doctor. If you don't think a treatment will work, be honest with them, say, hey, I don't think this will work, and explain why. And don't be afraid to say no. You can refuse any treatment or any testing that they say that they suggest. Also, as Stephanie said, ask questions. If they're prescribing you a medication, ask why that medication specifically, ask what are the side effects of it, how much it's likely to cost, and do the same thing for treatment and testing and procedures. And ask for other testing. Especially if they don't want to do testing, ask, hey, other people I know have had this testing and it's given them this result. Is that something that I could have? And give as much detail to the doctor as you can. Get into the nitty-gritty of it, even if you don't really want to. I know it's challenging, especially with like GI issues. It can be challenging to talk about, but give them the details. That is what helps them diagnose, what gives you the correct treatment. And if the doctor can't help you, ask for a referral. I always think the best doctor will admit when they don't know what to do and tell you who else to go to. I'd much rather prefer them than saying, I don't know what to do, goodbye. Ask about next steps and other options. So ask, if this treatment works, if it doesn't work, what do I do after this? And then also, as always, don't be afraid to speak up. Yeah. Oh, and if the doctor refuses something, then ask them to put it in your chart and document that they refused it.
Yeah, and something I wanted to throw in, just because I know I've probably said this to a handful of y'all through times just talking about accommodations. No one is going to advocate for you better than you. You know your situation, your disability, your chronic illness, the best out of anybody. So kind of just going into this, trying to create a teamwork dynamic with your doctor. You're the one dealing with this. You're the one in your body every day. So just kind of taking that in stride as you deal with these situations.
Definitely.
100%. Yeah. And some strategies for after the appointment. Talk to other people with your condition, if possible, if you've connected with people, excuse me, or people who have similar symptoms to you, or you've met like in a setting like this, like at a club. Like if you have met someone that's dealing with something similar, talking to other people can really help. And you can ask them about their experiences if they're open to talking about that, and find organizations, Facebook groups, Instagram pages, Discord servers, Reddit, subreddits. There's so many different resources online that you can find to try to connect yourself with other people that have the condition that you have and get suggestions from, and just accepting and feeling more open about the whole situation. And don't forget to take time to process all this new information. You likely got through a lot of information with your doctor during an appointment, or you might have a lot of feelings about it if you're getting diagnosed with something and test results come back or anything like that. It's okay to take time to process all of that and to gather yourself. And for some people, they might feel relieved, they might feel grief, a mix of both, or not really feel anything, and that's all okay. Just processing your feelings and emotions during this time is really important, and don't be afraid to take time to do that. Also, if you found that your doctor was not listening to you very well or wasn't really helpful during your appointment, it's okay to seek out another doctor if you have the means to do so. Some doctors have better bedside manners than others. Some know more than others on certain conditions. So it's okay to adjust your course of action and plan if you felt that it wasn't going very well. You can also, like Jill mentioned, like for accommodation type things. If you find a good doctor, you can ask them for notes and accommodation letters to give to other doctors or to use at your school. You can even ask them for like an ER protocol if you have a condition that needs certain things. So like if, for example, like if I needed to go into surgery for whatever reason, I would need saline beforehand. So I have like a program in place with my doctor of like, here are the steps that I give, like to put in your medical binder, like we mentioned, like have that kind of stuff ready if you're planning on going to the ER or going into surgery or whatever other planned situation, if you're going to be inpatient, things like that. So you can ask your doctor to get accommodation notes or other notes. Usually a lot of doctors' offices now have portals, from my experience at least. Some might not, but it's something you can definitely call and ask about as well, depending on your physician and provider. And for accommodations for school and work specifically, you can do a lot of research. There's a lot of resources online at your fingertips. Askjan.org is great in terms of accommodations. They have like a whole list of accommodations, and they break down accommodations by like specific disorders and conditions that you can ask for, and it might inspire you for some ideas that might be helpful for you. Also make sure to familiarize yourself with the ADA and of your rights as a patient and as a student and worker. There's familiarizing yourself with that helps you know when to take action if necessary, if someone is denying you basic accommodations that are reasonable, and how to really navigate all of that. So just be as educated and knowledgeable about the ADA as you can. You can also ask other people what accommodations they found helpful. So if you know someone who's already like at your student disabilities office or whatever student center you guys have, ask them what they found helpful. Ask other people with your conditions what they found helpful at work or school, and just get as many ideas from as many people as you can, so you have the choice to make the correct resource choices for yourself. There's different accommodations like additional time on exams, alternate housing and food accommodations, alternate testing environment. Something going into college that I didn't even consider was, oh, I can ask for different housing accommodations. I didn't know that was a thing. So talking to more people, just making yourself as aware with all the different options you have as possible will only be good for you. So just never stop asking questions and trying to navigate what things might help you the most. You can also ask your school's disability department or student services center, whatever you have, what accommodations are even offered at the school, like what people generally go for, what they can help you choose and pick, and try to, navigate your own personal situation with them. And this is where you can often provide that doctor's letter we talked about, getting a letter from your doctor with specific accommodations lined out, and presenting that to your school. Often schools will ask for that kind of a thing, or work just to have like some sort of doctor's letter to back up what you're asking for. Yeah, and you can from knowing what accommodations you want beforehand is always a good thing too. You don't want to walk into a situation where you're asking for accommodations and you don't really know what to ask for. Just being prepared as much as possible is really good. And also note, you don't have to disclose anything you don't want to in this process too. Something that I've learned the hard way is you probably don't want to disclose that you have certain conditions or are seeking accommodations like in an interview with a job or something like that. Unfortunately, I know jobs aren't supposed to discriminate, but that does happen in real life, unfortunately. So you want to protect yourself as much as you can, and make sure you have like a job offer in hand before you start talking about all these things. And you don't want to scare off anyone because you want to prove yourself and know that you can do the work and do what you need to do.
So I wanted to say something real quick. So when it comes to, kind of figuring out what these accommodations are and how they're helpful, getting those letters from your doctor. I know for me, it took several months. It took several different doctors before I could get one to realize, oh, wait, this is impacting you day to day and you deserve to be accommodated in your classroom. And that can be really tough to navigate. So if anyone here ever needs any help with that, please feel free to come to us as an executive board. I know myself, I've navigated a few different times. I know Stephanie here online has navigated it, because it can be difficult to talk about that with the doctor. A lot of doctors, especially when they have a young patient, they don't want to think that this is a disability. They don't want to put that on you. But I know that I basically told my doctor, you're not putting this on me. This already is on me. This diagnosis on its own is disabling, and I need my help to match that. So kind of leveling with your doctor, being honest about this process. But when it comes to accommodations for work, while I definitely hear what you're saying about like the hesitance about disclosing, to be protected under the ADA, you do have to disclose that you do have to disclose that you are disabled in that application process to ensure that you are protected under the ADA. So that's something you kind of have to navigate to kind of think of, like, if you know you're going to be asking for accommodations and someone might try to deny those, the application process is what's going to make sure that you can get those. So it looks different for different people, of course, and that's something that's why, you know, disabled groups are really important, like talking with one another. What does this process look like for you? What does it look like for you in this kind of job setting? So yeah, just kind of throwing that out there because it can get a little finicky at different points.
It's
Yeah, and it
definitely
also
different for everybody.
Oh yeah.
Yeah, for sure. It's definitely also different depending upon like what kind of, I guess, job you're going for, kind of too, because like I'll just use my most recent example. I'm working as a rehab nurse tech at a hospital, and there was really no opportunity for me to talk about my disability or like accommodations and stuff like in the whole interview process. That's more of something that came afterwards of like when I got the job offer, for example. It's like it's not really something you put on your resume like, oh, I'm disabled and I will need these things. It depends on.
To speak over you, but like a lot of times in the application process, it'll have that. Was that not the case here?
No, that was not the case in this job opportunity. So it really depends upon what circumstances your job throws at you. So like if there is a place like where they're like asking about like, oh, like, are you disabled? Will you need accommodations? That kind of a thing. It depends on a lot of different things. So if there's an opportunity, you should say that, obviously, like to, you know, protect yourself under the ADA. It just depends upon a lot of different things. So, but
Okay.
thank you for pointing that out, Jill. That's a good thing to know.
Okay, some things to avoid. So unfortunately, if you do get emotional in a doctor's appointment, doctors can use that against you. And unfortunately, it increases likelihood of the medical gaslighting you and, you know, telling you that they'll refuse to treat you or that it's all in your head, you're over exaggerating your symptoms, or you're drug seeking, or you're hypochondriac, or any of the other long laundry list of things that they could say. And if you do get emotional, it's okay. Don't panic. You know, make direct eye contact if you can. Express how serious you are and how severe your symptoms are. Another thing to avoid is bad doctors, as we talked about. You know, try to find a doctor that other people recommend. And even if someone else recommends it and you go to see that doctor and you don't like that doctor, that's okay. For some people, they're helpful. For some people, it's the worst doctor in the world. It depends on you, how you are, how that doctor is. It all depends. And if a doctor's not listening to you, again, make sure they document that in your record.
Yeah. A lot of times they'll try to brush you off or things like that, and just making them reflect and be like, can you please document that you're refusing treatment at this point in time in your chart, makes them feel accountable, because they are accountable in the situation, but just letting them brush you aside and go on to their next patient, they're not really having any accountability there of what they're actually doing. So just an important thing to point out. Another thing to avoid is like toxic social media circles. A lot of groups online are very helpful and they provide a lot of support for a lot of people, but some exist out there that kind of focus all on the bad, and like everyone vents and gets in all up in their symptoms and just only focuses on the negative things, and that can't be a healthy space for anyone's mental health, really. So try to protect yourself, and it's obviously great to vent and it's great to find other people that are dealing with the same things, but just try to make sure that you're not only doing that and you're only like caught up in how you're physically feeling. I know it's really hard, especially when you don't really have some place to navigate for help yet. But try to stay out of the only negative, only toxic kind of situations for, yeah, exactly what Jill put in the comments too. That kind of also ties to unhelpful friends and family. A lot of the times our friends and family want to help us. They want to be there for us. You don't need to avoid them. It really depends on, again, context. Some people, some family members or friends might have like abusive, toxic mindsets, but others might have your interests best at heart and they're just trying to help, being like, hey, I did yoga and it really helped me with these symptoms. But it's they're trying to help and they're trying to do what they can to help, but they're not familiar with this whole process either. They're learning along with you. And if you have the time or grace to try to educate them
Yes.
on the process of what you're going through, and just trying to explain how you're feeling and try to get them to, try to actually feel what you're feeling. That's great if you have the time and opportunity to do that. They most likely want to help, but they don't know how, and they don't know how to best support you. So setting boundaries and talking to them and letting them know what you need from them is a really good thing. But some other things to generally keep in mind, if you're willing to share your experience, like Sarah and I have chosen to do, please do. Like, people want to hear you and hear your valuable insight and experience. Recommend doctors to them, other helpful resources they found. You can share your experience with treatments, medications, testing, and everything. But do keep in mind that everyone reacts to certain treatments and other options individually and differently. They vary from person to person. So like Sarah said, like, one doctor might not work well with you. One medication might not work well with you that actually worked for someone else, even though you have the same condition. Everyone's body is different, and just keep that in mind when you're seeking advice from others. You can't copy and paste someone's treatment plan to yours. That's why we go see doctors. So another thing to just keep in mind in general, if you have a good pharmacist, hold on to them dearly, cherish them. There, a lot of pharmacists are really great, but some go above and beyond in terms of seeking out medication. I had one for me, literally ordered medication from a different state completely, and took so much of her time to try to find it and get it back to my home state. So if you can find a good pharmacist, hold on to them, cherish them. You might end up needing them at some point in your life. So it's just great to have that option and resource out there, and to also help you fight with insurance as well, to get coverage on certain things. So there's that. Some hospitals and doctors' offices also have things called patient advocates. Does anyone here generally know what a patient advocate is, or have they heard of that before? But in case you have not, it's actually like a career, like it's an occupation that some people have. There's a place for people to literally help you fight for these things in doctor's appointments or at hospitals and different locations. You can ask your doctor's office if they have a patient advocate available to work with you, or in a hospital setting. So there's people that have literally the job of helping you get accommodations, helping you through the whole process of a doctor's appointment, help you take notes. There's a whole wealth of resources that they can provide. So looking into seeing if your local communities do have that, that's a great option too. And like we mentioned, making connections with people, whether it be online, in person, like this lovely group of yours. Make friends with people who have your condition or similar conditions. It can help just going through the process with someone and knowing that you're not alone, like Sarah and I met. It's great to have someone that helps you stay accountable and help you and support you in being an advocate for yourself. They're not specifically advocating for you per se, but it can make the whole process a lot easier having someone to support you. And also to note, if you are going to the ER or an inpatient setting, like, bring your own meds. They might not want to give you meds if they don't believe your condition, you don't know what doctors you're going to be working with. And oftentimes, like in an ER setting, they're just trying to keep you alive. So if the medication doesn't keep you alive, they might not care. So if you are planning to go to the ER or an inpatient setting, do bring your medications if it is allowed, to note. So, and also if it's not a common medication, they might not have it stocked on hand. Like I said, someone had to go out of state and get medication for me as an example. So
some resources that we have. So raredisease.org/rare-diseases. Raredisease.org has a whole list of rare diseases, and they often list organizations that do things with that condition. Some other great things are Facebook groups, Discord servers, finding Instagram friends, and as Stephanie said, Reddits as well. And places like the Mighty, they have different stories, and you can even write for them. Chronic Warrior Collective, they have a card exchange, so you can make some pen pals. Stuff that works. You can learn about different treatments, what other people have done with your condition. Social Health Network is another great place to meet people. So is Patients Rising, and Savvy and Rare Patient Voices has you can do surveys about your condition and get paid for them.
yeah, so there's a lot of great resources, and yeah, we'll be sharing this presentation. So your group has a whole copy of it and you can do whatever you want with all these things. But yeah, there's a lot of resources out there, so don't be afraid to seek help or to just search around. There's a lot of great things that want to help you. And we'll be around. I know you guys have a whole discussion planned and everything, but if you have any questions about anything that we've talked about today, please don't hesitate to ask. Sarah and I can pop our emails in the chat. We have a general email for answering questions, and we have our personal ones too. But anything that we can help support your group or anything with, I know your board members are very involved as well. So we're here to answer questions and do anything. We're open books.
Yes.
Thanks so much for sharing with us. I wanted to go ahead and like I am pretty familiar with a few of these resources. The Social Health Network has patient network websites based on different conditions, like there's ones for specifically endometriosis. I know I'm a writer for axial spondyloarthritis, that's arthritis of the spine. So they have some really great information, thorough information on conditions. Patients Rising is also excellent for like learning how to advocate for yourself. Savvy and Rare Patient Voice, they will pay you for patient insights. Your opinion is valued and they make sure to make that happen. I know Savvy in particular is run by someone who also has rheumatoid arthritis. So I want to throw that out there. But thanks so much for giving us this presentation, y'all. As far as our extra credit students go, y'all can feel free to come up and check out with me or leave that information in the chat. Let me grab my notebook to remember what exactly is needed. I'll just need y'all's name, your professor's name, your course, and the section of the course. So for y'all in person, you can come up here, and then y'all can put in the chat for Zoom. But otherwise, if anyone has any questions, please feel free to go ahead and say them out loud here or put them in the chat or unmute yourself on the Zoom.
Stephanie and I are pretty much open books about most things.
Yeah, for sure. And yeah. Yeah, we can go over the little things to remember. You and your symptoms are valid, so please believe in yourself and don't let yourself get gaslit by medical professionals if that's something you unfortunately have to come in contact with. It's normal for it to take to take it a long time to get diagnosed. It can take years sometimes. Don't lose hope. There's people that are willing and ready to help you out there. Reach out to others when you need help. If you need support from friends, family, things of the like, if you need to find a group like this, there are people to help and support you, and it is possible to get help and feel better. It may take a long time, but it certainly is possible. So please don't lose hope. And try to show others who don't understand some grace, but do protect yourself first, like we talked about with toxic family friends, things of that sort. You're important. You need to protect yourself, and that's comes first. And also just be kind to others in general. You never know what someone's dealing with from just looking at them. That involves both invisible illnesses and just life in general. It's like people can be going through and having a hard day and you have no idea. You can't tell by just looking at someone. So always be kind and try to consider other people's feelings as well as your own. And good luck with everything. And if you guys really do have any questions or comments, concerns, anything, we'll be around.
Yep.
Yeah, and thank you so much to Jill and the whole board for hosting us and letting us present to you guys. We really do appreciate it, and I hope that you all learned something today, even if it's yeah, just a good reminder.
We have someone with a question in person.
Awesome.
Contact information in like the group or something.
Oh, yes. Can y'all send me over Instagram the contact info so I can make sure to get that to our people in person?
Yes, for
definitely.
sure.
I'll
I'll also
put that in the chat. Yeah.
Great. Let me get all these. Goodness, so many karate students. We love Body. I know I had a question, but I wanted to go ahead and get the extra credit students done. So let me just get through this and then I will go ahead and throw that out there. All right, here we go. All right. My question was, okay. How would you recommend navigating conversations with professors about chronic illness? I know for me, like, it took me at least a full semester before I could get a doctor to even write a note. So a lot of my accommodations were like unofficial, just from having conversations with professors. So if y'all had any insight on that.
Yeah, for sure. So my experience was a little bit different than yours. I did come into college having doctor's notes ready and everything because I did have some accommodations in high school. I know everyone's not like that, obviously, though. So I would always set time out I'd email all my professors at the beginning of the semester as soon as like I had their contact info and knew that kind of thing. I'd ask to be like, hey, could I stay after class on the first day? Or is there some time during your office hour that's protected? Or could I just have a private meeting with you for just like a few minutes to talk about like my condition? And you can choose to disclose anything you want to. You don't have to talk about your condition specifically with professors, obviously. I chose to, but that's all up to you. But just taking time out to talk to your professor one-on-one and asking them what it is hard because some professors are more lenient than others and some want to help and some don't really show that. So it kind of depends on professor, but general things like asking, just trying to help have them understand kind of what you're going through and that you're trying and showing an effort in their class and that you care about the information presented in class goes a long way. And they'll often want to support you and want to see you come to their class and have all the work that you can do. Sorry, was there like a more specific question of like how generally it's like I'm sorry, it's like kind of an open-ended question because it really depends professor on professor. You kind of have to gauge the situation and see like what they're willing to work with you on, but just trying to be open generally has good results, at least in my experience. And they're often there to help you.
I know in my experience, a lot of it was like kind of opening up that door to having an honest conversation about it. Kind of like let the professor know, like, I'm not just skipping class to skip class. Like, I'm in a good amount of pain. Like, I would rather be in class, actually. And different things like that. Just kind of opening up that door and that kind of, because a lot of professors, they do want to help. Like, I know, like, for me, I'm in the College of Behavioral and Social Sciences. So I would say, like, these professors are a bit more open-minded at large. And I know, unfortunately, some of our STEM students have had some trouble, but either way, opening up that conversation, opening up those doors is, that first step. And, if/when anyone has any trouble with that sort of thing, please feel free to come to STAG, come to us, figure out how we can navigate this thing. Because I've also had professors who haven't been so great about it. Professors saying like, oh, your disability shouldn't impact your education. Yeah, it shouldn't, but it does. That's the reality of it. So just having different just opening up those conversations. And of course, I've been pleasantly surprised by a lot of my professors. So
yeah, that's great. Communication is like the number one thing, honestly. It's like just being open and communicating what's happening with your professors, making sure they're in the loop on things. They appreciate that far more than we will ever understand. And it gives them more of an insight and idea to how they can best help you.
And another thing to keep in mind, assuming your school has a good disability department, if your teacher is not following their accommodations, talk to your disability department, see if they can, obviously they can't always help, but hopefully they try their best to help and to talk to the professor if they're not doing what they're supposed to be doing.
Yeah, it is harder, especially when, like Jill mentioned, like not having a note or a doctor's note ready and things like that, and not having accommodations in place at the school. It does make the whole process a lot more difficult, but that doesn't mean you can't reach out for help. You can definitely certainly contact your disability office, or if you know of other students who have accommodations, ask them what best worked for them and things like that. There's people out there willing to help you. You just need to know where to ask and who to ask.
Yeah.
For sure. Let me see. I've got some stuff in the chat. Okay. We got a question. What if the teacher does not abide by your accommodation? Oh, you just answered my question. There we go. Okay. But when it comes to like those legally binding accommodations, that's where SARC can definitely come in. But SARC is limited, by the ADA and by the law. And unfortunately, if your doctor won't write that letter and you're still struggling to navigate that process with your doctor,
they can't legally.
Like legally,
They
You're-
don't have to do anything.
Legally, your professor is not obligated at that point, but a lot of times, our professors are people too, just like we're people too. So sometimes opening up that door of like, hey, I'm a human struggling. Let's see what we can do to like, your professors want you to learn. So I've been pleasantly surprised. I've gone into appointments assuming the worst of like, my condition sounds fake. People could assume my condition's fake. And of course, that was my little bit of internalized ableism. But again, people pleasantly surprise you. There's a lot of, yes, that's what I'm trying to say. Okay.
For sure. Like there's definitely like obviously there's bad professors out there, but like most generally do want to help you. And it's a good thing to constantly remind yourself of and be like, hey, they want me to succeed. They want me to do well in their class. They want me to communicate with them. So just try to remind yourself of that. And obviously you'll come into some bad ones, but most are good, at least in my experience. And it sounds like your experience too, Jill.
Yeah, for sure. Especially as I've gotten up in college. Your professor will kind of recognize like you're trying your best. It's just there's a lot of life stuff that can get in the way of trying your best.
Yeah. And I found like if you do happen to miss a good chunk of classes or anything, if you are able to go to their office hours, if they have them, that shows that you're doing effort and you're trying and things like that. Same with emailing them questions or whatever your professor prefers, just showing that you're active, even if you're not necessarily present in the class for whatever reason, that they notice that. It doesn't go unnoticed.
Absolutely. I know I had a semester where I had to miss at least 5 classes and I hated it because I was very excited about the course otherwise. Like intellectually, I was very excited about it, but health happened instead.
Yeah.
I basically just kind of made it very clear to them, like I am doing this learning on my own at home. I feel very confident in my understanding of the material. Otherwise, I wish I could be in person. It's just not realistic for me at this point. And that was something that we were able to navigate and figure out how I could still learn best despite what was going on with my health at that time. And then I had a professor once tell me that they wanted to help me learn the best that I could. And that was something that was very reassuring for me, especially as someone who was newly disabled at that time. It's like, there can be a lot of imposter syndrome there as a disabled student. I felt that way.
100%.
Yeah, but I would say like my disability is kind of better informed me as a student. I think I would view a lot of my education very differently if I didn't have the experiences that I do.
Oh, 100%. That's why I enjoy being so open about it, especially like applying to med school next spring and everything. It's like, well, one, I can't really hide from it at this point. I kind of made a nonprofit with Sarah about it. So it's kind of, you kind of have to be open, but it's just, it helps yourself too, to be like a little more open and freeing. It gives you power and control over what you want to share with others and how your experiences have shaped you. And yeah, helping others navigate is also a huge thing that at least helps me personally too, knowing that sharing my experience is helping someone else, and that makes me more confident in my experiences and how, you can navigate stuff within itself.
I will
Absolutely.
definitely second that.
So does anyone have any questions? Just about patient advocacy, any of this at large?
Or just Stephanie's experience in general.
Yeah, honestly, anything. And if you don't think about it now, please definitely take down our emails and everything. We'll
Or
send
message us on
everything to
Instagram.
yeah, we'll send everyone an email with everything to Jill so she can spread it out to whatever you guys have. But we're always open books, so whenever you think of a question, if you have one, feel free to send an email.
We got a question here in person.
Yeah, so I was just curious when they were doing the introductions, I had heard of something I wasn't unfamiliar with that had to do with one of the things that she was like one of the symptoms she was carrying. I forgot the name of it, but it had to do with like certain joints and the organs.
Oh, EDS.
Yes. Yes.
Yes, this is my first time hearing it. I'm just kind of curious about with organs not staying in place, but they how does that exactly work? And could she provide some if she wants to
Yeah, definitely. So the way I for example, with blood vessels, it makes them wobbly. So it means they don't hold their shape as well as they should. And that's the same for organs as well. So my organs, I guess, are wobbly is the best way to kind of describe it.
Yeah, like basically like everything in your body is made up of connective tissue. And when that's faulty from the start, it's kind of like your body's trying to catch up. There can be a lot of, I know most people I know with EDS do live with chronic pain. And I have known someone who had EDS who their organs would, like when they would stand up, their organs would basically sag.
Mm-hmm.
Because that connective tissue wasn't keeping them in place the way they should. And that would cause a lot of issues with like digestion, different things like that. Like if they laid down, their organs were where they should be, but standing up, it would just be a completely different story.
Yeah.
So like EDS is one of those things where it currently is defined as rare, but a lot of people theorize, especially with hypermobile EDS, there's a lot of versions of EDS.
Yes.
Basically, a lot of people think that it's not actually that rare.
Yes, there are 14 types in total. Hypermobile type is the most common. So basically, hypermobile type affects the joints more than anything else. But each type affects a different thing more. So for example, vascular EDS affects the blood vessels more. But there's also a periodontal type, which affects the gums more. But personally, for me, the thing it affects most is my joints. Obviously, I have the hypermobile type, and it affects my right shoulder the most. So especially in my sleep, if I move my shoulder the wrong way, it dislocates. And in the morning, I'm in a lot of pain, and I have to usually manually put it back in myself because it doesn't want to go back in properly. And part of the tricky thing with EDS is after you dislocate a joint, you're more likely to dislocate it again and again and again, even if you don't have EDS. But when you have the EDS, you're at an increased risk of dislocation in the first place. So it's just exponential from there.
Yeah, and that's like if you see some people with EDS, you might see some people having like little finger braces, or like some people use neck braces, and just different things to help them keep their joints in place more. That might also be a reason for someone using a wheelchair. If they walk and their joints pop out of place really easily, it's just like a preventative measure, and it also, it's a mobile aid device. It helps them get around. So there's like Sarah said, there's a lot of different types of EDS. I know you're in person, but there is a Ehlers-Danlos Society. They have a lot of great resources on Ehlers-Danlos, and a lot of just general information. So if you're interested in learning more about that, that's a great resource.
And since you were asking about organs specifically, it is very common for people with EDS to have something called Chiari malformation, which means that the brain actually sags, as Jill was talking about, but it's the brain sagging into the spinal column, which causes a whole host of issues, mainly like migraines, but it can also cause a bunch of other stuff.
You were trying to say something earlier.
Oh no, I was just
no.
I was informed the same thing. I had dislocated a shoulder earlier this year, and ever since it got hit, like through overuse, if I'm doing something, I can feel like it will click, like I can feel like it clicking, like that sound. So because I know I was going to physical therapy, the therapist informed me that like once it happens, there's a high probability of it happening again.
Yeah.
Especially with shoulders.
Yeah, shoulders are funky. They like to be, my shoulder likes to be mad, I should say. But yes.
Yeah.
Any other thoughts before we wrap up? Thumbs up. So for those of y'all in person, I will share these emails, the emails in our Discord and our group me. Robert, I'm not sure if you're in any of our chats, but I will set you up with that. But Sarah, Stephanie, thanks so much for coming by. I learned a lot. And yeah.
Yeah, thank you so much for having us. Yeah, we're happy to be here.
And feel free to contact us with any personal or general questions. We'll try to answer them the best we can.
Yep, same open book for pre-med too. So if any of you guys are pre-med and want to talk, let me know.
We got. Yes, I have access to the PowerPoint. Are you guys okay with us sharing the PowerPoint with our members?
Definitely.
100%. And we also have there's notes in the slides too of stuff that we were talking about. So if there's some more details that weren't actually on the PowerPoints, there's presenter notes if you want to look in those too.
For sure. And for our extra credit students, if you guys have put that information in the chat, I've already gathered it. So you guys are good to go. But again, thanks so much for coming and joining us. I know I've been recording this, so we'll probably put this out